recovery room nurse at a general hospital. You receive from the surgical unit an 80-year-old female who has just undergone a successful hip replacement surgery. She has oxygen support from a non-rebreather mask and an IV with normal saline. After 2 hours of monitoring the patient, the monitors begin to alarm. You check the heart monitor and find the following ECG tracing. Question 1. What is your interpretation of the ECG tracing? A. Pulseless electrical activity. B. Ventricular tachycardia. C. Atrial fibrillation. D. Ventricular fibrillation. Correct answer, D. Ventricular fibrillation. Ventricular fibrillation is characterized by a complete absence of QRS complexes and P waves. In VF, there are chaotic electrical impulses. This produces an uncoordinated and very rapid series of ineffective ventricular myocardial contractions. You check the patient and she does not respond. She has no pulse and is not breathing. Question 2. What is your next course of action? A. Shout for help and activate the emergency response protocol. B. Give epinephrine 1 mg intravenous bolus, followed by saline flush. C. Start high-quality CPR. D. Perform precordial thump. Correct answer, A. Shout for help and activate the emergency response protocol. This is the first most important step. This will alert the ACLS team and bring in the crash cart to the scene. The crash cart contains defibrillator medicines and advanced airway devices. You begin CPR while waiting for the ACLS team and crash cart to arrive. Question 3. What can you do to support the patient's oxygen delivery? A. Increase oxygen via non-rebreather mask. B. Give 2 rescue breaths. C. Look for a bag mask device and give ventilation through bag mask at 10 cycles per minute. D. Nothing needs to be done. Continue CPR and wait for the emergency team to arrive. Correct answer, A. Increase oxygen via non-rebreather mask. Passive insufflation of oxygen into a patient airway may provide oxygenation in the early stages of cardiac arrest. The ACLS team has arrived. While performing high-quality CPR, a biphasic defibrillator is attached to the patient. The ECG monitor of the defibrillator presents the following tracing. Question 4. What is your next course of action? A. Stop CPR and check for pulse. B. Stop CPR and give 1 mg epinephrine followed by normal saline flush. C. Stop CPR and immediately defibrillate. D. Stop CPR and provide advanced airway. Correct answer, C. Stop CPR and immediately defibrillate. We are still managing ventricular fibrillation, and ECC guidelines highly recommend immediate shock for VF once a defibrillator is available. After your previous therapy, you check the cardiac monitor and see the following tracing. You check the patient and find a pulse and spontaneous breathing. The patient, however, cannot be aroused. You check the vital signs and find the following. Heart rate, 42 beats per minute and regular rate. Blood pressure, 100/60 millimeters of mercury. Respiratory rate, 10 per minute. Oxygen saturation equals 89%. Temperature equals 36.2 degrees Celsius. Question 5. What is your next course of action? A. Infuse norepinephrine, 0.5 micrograms per kilogram per minute. B. An intravenous bolus of 2 liters normal saline. C. Look for treatable causes of cardiac arrest. D. Intubation with waveform capnography and mechanical ventilation. Correct answer, D. Intubation and mechanical ventilation. We have achieved a return of spontaneous circulation. Immediate post-cardiac arrest algorithms suggest that ventilation and oxygenation must be optimized. Question 6. Proper ventilation and oxygenation are achieved at an oxygen saturation of A. 92 to 98%, B. 96 to 100%, C. 98 to 100%, D. 100%. Correct answer, A. 92 to 98%. The goal for oxygen saturation following ROSC is 92 to 98%. Question 7. Which of the following procedures optimize oxygenation and ventilation? A. Hyperventilate the patient to prevent an increase in intracranial pressure. B. Measure oxyhemoglobin saturation by pulse oximetry rather than arterial blood sampling. C. Maintain partial pressure of CO2 at 35 to 40 millimeters of mercury. D. All of the above. Correct answer, C. Maintain partial pressure of CO2 at 35 to 40 millimeters of mercury. AHA ECC guidelines recommend that EtCO2 be maintained at 35 to 40 millimeters of mercury. Hyperventilation is one of the factors that diminish survivability and cause poor outcomes to in-hospital cardiac arrest patients. True or false, actively prevent fever in comatose patients. Correct answer, true. Observational studies have reported that a patient who had just achieved ROSC with fever is associated with poor outcomes. True or false, all comatose patients should be actively maintained at a temperature between 32 degrees Celsius and 36 degrees Celsius for at least 24 hours. Correct answer, true. Targeted temperature management for comatose patients aims to preserve the brain and heart from further damage by reducing the metabolic demands of these vital organs. ECC guidelines now suggest that a temperature between 32 degrees Celsius and 36 degrees Celsius must be maintained for at least 24 hours. True or false, it is reasonable to avoid or delay the correction of hypotension. Correct answer, false. Avoid hypotension and immediately correct it during post-resuscitation.